We have Young Hawk here, and he has been a patient for a little bit. I'm Dr. David Warwick, Warwick Chiropractic in Lacey, Olympia, Washington. And the purpose of doing this particular video is I have already adjusted him. I was like almost halfway through, and then he had mentioned to me, hey, the gastric reflux, the hiatal hernia, the GERD, the GERD that you'll see a lot of times when you look it up on the internet, can be helped and benefited by utilizing chiropractic. And so one of the things that I do is I help show patients things that you guys can do at home with someone else assisting in it to help reduce some of that gastric reflux and that. I just want to check just a couple areas of the spine. He's been laying here and relaxing, and we're going to just double check. So one of the primary areas where we have the gastric nerve goes in to and toward the stomach, that can affect it. So typically middle of the back, and I just want to make sure that's cleared out right through there. A little bit more breath in, blow out. And there was just a little bit more in that area. You could feel it as it moved, so I went just down. All right, lift your head for me and back down. Good. Lift your head, back down, and just a little traction. Good. And here's what you guys do at home. So go ahead, bend your knees, put your feet on the table for me, just like that. It relaxes the abdomen area. So I want you to take your fingertips. Now the stomach area and the diaphragm is a dome-shaped muscle right here. It helps with breathing and respiration, but it also can affect the muscle area, so that when you have a pinched nerve, the muscle, the sphincter of the muscle goes around, and if it's not functioning, will cause gastric juices to come up into the esophagus area. And so that's another area, working the diaphragm, pulling down on it and adjusting the mid-spine right around T6, sometimes T5, T7. Those are the primary areas that'll be affected. Most chiropractors will look to that. So what you do when the patient is laying on their back, floor, or a bed, place your hands just like this, one over the other, slightly angle them, and you'll go right across. So point the fingers almost toward the shoulder, just like this. And I want you to take a deep breath all the way in, release it out. And what I'm doing is just notice how I went gently in like that. And I'm going to do like a scooping motion. Breath in and out. And so I'm going to get in, feel out how I'm going a little deeper. Breath in and out. Okay, and he just resisted. I went in a little deeper, but I'm pulling down and doing a scoop. Breath in and out, and then pulling down. It's not very often someone goes into that stomach area and you slowly come off of that area right through here. Take a breath and just really easy. So guys, the motion is like a scoop motion like this. With a breath, you go in, scoop. Let them rest with that for a little bit. Breath in, have them take a breath in, scoop some more. Breath in, scoop some more. So you can do that like 3 or 4 breath sets of breaths. The thing that you want to be careful of, because this area can be really sensitive on the ribs, you want to get out far enough away from the ribs initially. So big breath in and blow it out. Big breath in and blow it out. Big breath in and blow out. And pulling toward me. And then I slowly come off it. Everything's really slow and deliberate. And you don't want to go hard and fast on them. You can even do, are you ticklish here?
No.
Sorry. You can even do slight, where it's pointed straight toward the sternum and the chest area to pull it down as well. But of course, you got to be really careful at the tip here of the sternum is a xiphoid, very sensitive for people. So if there's nauseousness, You got to be really careful, but you can pull down there as well. So the pull is gently right across through this area. How's that feel on you?
It's getting better. Thank you.
A little bit better on there. So your significant others or a good friend, hopefully, can help you doing that. Now remember, everybody's pain tolerance is a little bit different and sensitivity to that area. So just be mindful about what you're doing. Be slow and controlled with it. If you're not getting improvement or results with that, or some kind of changes with the gastric reflux, I would say come into your local chiropractor, and most of them are trained to do that kind of technique, especially the adjusting, which is where it originates from, or where most of the problem is coming from the spine. That's where we see it. So that should help, especially when you're not seeing me. A lot of patients report, as you will too. I think we've done this in the past, or I feel like we have. Did you have some improvement when we did this? Okay, so the purpose of this video was to share with you guys out there so you can do it on your own. It's not difficult, it's just knowing what to do with it when patients have that. But I would say there's still an underlying cause to it. There's usually a spinal misalignment associated with it because of the tension in the back. So I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. You feeling okay?
Yes.
Good. All right, guys. I'll see you later. Oh, drink plenty of water too after doing something like that. All right. Be safe. See ya. Visit my YouTube channel. I'll see you later. Bye now.